Hello everyone and welcome to our video on long COVID and long-term conditions in the workplace. I'm Becky Thoseby, I'm Head of Workplace Wellbeing at the Ministry of Justice, and I'd like to introduce Judith Grant. Judith, do you want to introduce yourself?
So I'm Dr. Judith Grant, Director of Health and Wellbeing at Mace Group, who are a global construction and consultancy organisation.
Thank you, and I'm also really pleased to have with me today Sally Hemming. Sally, do you want to introduce yourself?
Yes, thank you. So my name's Sally, and I am currently on a career break from Ernst Young, where I was an associate director in the talent team. And I have just completed a PhD programme examining the workplace support needs of workers with long-term health conditions.
That's great, and I'm certainly going to be asking you more about that as we go through. So Judith, I'd like to start off with you. Can you just tell us a bit about your experience recently that you've had of having long COVID?
Yeah, no problem. So I fell ill with suspected coronavirus in early March. Now, at that time, there was no community testing available in the UK, so I didn't have a definite test, but I think most medical people are fairly certain that I had it, given I've now been ill for just over 8 months, since having the illness. And there's some research saying maybe 1 in 10 people might get long COVID, and it's basically undulating symptoms over a long period. So I started off with the cough, sore throat, kind of low fever, and feeling quite unwell when I first presumably was infectious with the virus. But it just kept coming back. So I thought I was better after 2 weeks. So I tried to go back to work. I managed half a day and ended up with a fever and more unwell. And kind of from there, I've had tonsillitis. I had that for a number of months, and I've been to A&E 5 times over the course of the last 8 months with breathing challenges. So it's been kind of relentless, really. And I've tried to go back to work 3 times, in fact, through that period. And I know we're going to talk a bit more about my kind of work experience later on, but I kept thinking I was getting better, and then I got really ill again. And now 8 months on, I am under the care of a cardiologist looking at potential damage to my heart from the virus. I've got extreme fatigue, and I'm still a bit croaky. I haven't actually had my normal voice for about 8 months, so I still have a slightly swollen larynx and tonsils. And I've had all sorts of other kind of sort of weird and wonderful kind of symptoms over that time. And people talk about the long COVID lucky dip, where all these different symptoms keep coming in, and some of them go, some of them stay, and you don't really know what when you might recover. So that's kind of where I am at the moment. It's been a very distressing, very distressing at times. So obviously there's a psychological impact to it as well, and not knowing when you're going to get better is also quite a challenge to get your head around.
And certainly that kind of unpredictability that is a common factor of many long-term conditions is something that's really difficult to deal with. And I mean, one of the reasons why we wanted to get together and talk today was because long COVID has been very much in the news, and that has kind of shed a light on other long-term conditions, hasn't it? So perhaps, Sally, you could tell us a bit about the differences and similarities between long COVID and long-term conditions in general.
Yeah, absolutely, Becky. And I think it's a good time to be talking about any aspect of long-term health, certainly in my view, in a more inclusive way. And I think what COVID has done is giving us an opportunity to do that. And just to sort of share with you, my view on some of the similarities between what I understand, the impacts of COVID are, and Judith, you've shared your experiences. One thing I'd kind of draw out, certainly from Judith's experience and what I've read and my own research, which was with people with long-term health conditions and not COVID, was the sheer diversity of the effects of health conditions. It is very rarely the case that one person's experience of something is the same. And this raises a number of challenges, not for the people that it's affecting, but also for those people around them, whoever they may be, in terms of family, employers, colleagues, clinicians, etc. In terms of what support do you provide and how do you know and understand what those support needs are. And what COVID has done very quickly, I think, has shone a light on actually perhaps our inability to understand those needs completely overnight, because of the urgency with which COVID is really, particularly affecting the workplace. Other things in terms of similarities and differences, I think one of the key things with long-term health conditions and COVID, and again, Judith has clearly alluded to this, is their ambiguity. And the disruption it causes to people's sense of who they are, particularly when you are not expecting something to happen to you or to come about, which can often be worsened where you have fluctuating health experiences. Again, Judith has very clearly alluded to being well, thinking you're well, and then suddenly realizing you're not well enough to do the things that you want to do. And that requires an adjustment. That doesn't just require a day-to-day activity and physical adjustment, but it requires a mental adjustment, a psychological adjustment to something that more often is not something that happens on day one and then the next day it's fine and you've accepted things. And this links together very neatly. And certainly, this isn't something we're welcoming, is that long-term health conditions and COVID have a mental health impact.
Yeah.
It is absolutely true to say that anyone affected by any type of long-term health condition is at greater risk of mental health comorbidities and experiencing challenges in that space. And I think, again, we're seeing that with COVID. And finally, what's really important when it comes to long-term health conditions, again, those issues that are related to COVID and perhaps those things we're going to be seeing and experiencing, certainly over the next sort of short, medium term, is that things need to be self-managed by the person themselves. So here we all are, at least us three, at least working at home. So when we're not in clinical care, sitting under the careful guidance and helpfulness and support of clinicians and nurses, etc. So that frankly means it's over to you. It's over to the individual. Now, for some people, that is an immense burden. Because they don't know what to do, they're not quite sure whether what they're doing is effective. And actually, it's really important that people get the right support in that space, because if they don't, then actually that could have detrimental effects in terms of health outcomes. So there are a lot of linkages, and I'm a firm believer that COVID is a great opportunity to really become more energetic about our conversations about long-term health in the workplace.
Yeah, and I really recognise a lot of the things you said there in terms of my own experience with having a long-term condition. So particularly what you say about it requires people to kind of recast their identity, and that process of acceptance. Certainly I have thought I had reached acceptance a number of times and realised that actually it was denial and I still needed to keep going towards acceptance. So thank you for that really, really insightful reflection. And Sally, I want to move to you next and talk about kind of what were your key research findings from your PhD?
Okay, so There's one overarching finding from my research, which I think is probably the most important one to mention, and that is that workers with long-term health conditions want support in the workplace from their employers to help them manage their condition themselves. That was absolutely clear from the quantitative and qualitative work that I did as part of it. But what also emerged from the study was that self-management support, and just to clarify, self-management is concerned with the things that people with long-term health conditions do for themselves. Mm-hmm. So, for example, that might be managing insulin levels for somebody with diabetes. That might be making sure you take a rest break, say, if you're affected by chronic fatigue syndrome. So things like that. That's what we mean by self-management. So it's quite a broad array of potential activities, as you might appreciate. But another important finding from the study is that type of support, so self-management support for workers specifically with long-term health conditions, was not meaningfully provided in the workplace, certainly in the sample groups that I was researching. Now, that is not to say that there is not workplace support for people. But what was clear is that was not specifically and meaningfully thought of as in terms of helping people help themselves in that way. So what that means in a nutshell is that sometimes the workplace support that was being provided, although perhaps being provided with the best of intentions, was not actually empowering to people. And it may not have been empowering, for example, because it was part of a formal process or policy in which the person that's affected actually becomes disempowered. So, for example, where you go from a healthy relationship with a manager or a supervisor, suddenly you find yourself potentially in a process where actually the outcomes to your health being looked after and managed are actually detrimental in terms of warnings, etc., or raising security concerns around roles that prior to those processes workers with long-term health conditions didn't have. And why this was important was because some of the workers that I spoke to with health conditions and some of the feedback provided, certainly in the survey study I did, hinted to the fact that people with health conditions were already worried about job security. And certainly some of those workers I spoke to were clear and understood that there could be a point in their future at which their ability to work could become quite difficult. So people were quite aware of that potential experience, particularly for those people with more degenerative conditions where things were worsening and were not recoverable. So that meant there was a real tension between some of those workplace benefits, processes and policies intended to help, but perhaps didn't help those people where things were not going to improve and there was no likelihood of improvement. And there was some tension in that experience of workplace support. Other findings that were really clear and certainly are worth mentioning were that workers appeared to adopt a disclosure strategy that was linked to getting support. So the majority of people had disclosed their health condition in my study, which on the face of it you would think is fantastic news, but actually that disclosure did not always appear to lead to the support that was needed. And I wasn't able in my study, because I didn't examine things like stigmatizing events, etc. But it suggests that actually disclosure may be helpful, but equally may not be helpful to people depending on their support needs. And personally, I found that quite surprising. As somebody that's worked in HR and wellbeing and D&I and all of those areas for some time, disclosure was always sort of bandied around as a really good thing. You know, this is a reflection of inclusivity and integration. And actually what this showed was a gap in what that disclosure was achieving when people were needing to manage their health conditions when they were in the workplace. Other things that are certainly worth mentioning are that there were a number of key factors and mechanisms that enabled people to manage their health easier. So empowering ways of working that actually made it possible for people to do what they needed to do when they needed to do it. And it's important to bear in mind that what my study showed was that actually workers with health conditions didn't need to be told what to do. They didn't need to be told by occupational health, for example, the sorts of things they might need to do, because they already knew what they needed to do. They just needed to be able to do it in the working day and on working premises, say, if they were in a workspace. And those key mechanisms are, put simply, line managers. So workers with long-term conditions, with managers who empowered them, were able to do what they needed to do, and suggested that they were more work engaged because of that. And the things that managers needed to do were only a few things. They were showing empathy and care and sympathy. That didn't need to mean absolutely understanding someone's situation, but trying to appreciate it from their point of view. And it was fundamentally about flexibility or leeway. Now, that flexibility and leeway didn't always need to be achieved via formal processes and policies, i.e. modifications, accommodations, etc. And what came out of it very clearly was that workers just wanted the freedom to manage their health when they needed to. Because for a lot of people, they couldn't see or foresee when they might need to manage their health. So where you had a modification, say, that may not always be helpful where that health situation changed, for example. So informal leeway was really, really important. But what was super interesting, because I interviewed employers as part of my research, was that actually employers weren't clear about what self-management support is. So that indicated that employers might benefit from understanding more about what people with health conditions need to do for themselves. And one of the outputs of the study is about really generating that narrative and generating that dialogue. That doesn't necessarily need to happen within those modification and adjustment type conversations. It could be a more day-to-day conversation with a line manager, for example, about what somebody's health needs are at any particular point. And one of the suggestions was that actually if line manager support was improved and helped people manage their health, those people might also be more work engaged and actually might be more positive about their lives and therefore report better quality of life and well-being. Okay.
Yeah, that's fantastic. I mean, so much food for thought there. And actually one of the things I'm really pleased to hear is that the findings are actually quite congruent with the approach that we take at MOJ already, which is very much around responsibility for the individual's well-being being shared between themselves and their line manager. So I just actually wanted to reflect on a couple of things that we've been doing recently in this space. So first of all, I've designed a well-being for line managers e-learning package. So that kind of does what it says on the tin. It takes line managers through the basics of what they need to know around well-being. So it explains the person-centered approach we take to well-being in MOJ, which is around treating everyone as an individual with their own unique package of needs and treating the person, not the condition. So it's a kind of very much an inclusion-focused approach. And the spirit of empowerment is very much there. So, you know, educating line managers on what a person-centered approach is, explaining to them what their responsibilities are. So we kind of split it into 4. It's around making people aware of the support that's available and giving them time to access it. So exactly what you were saying about, you know, the time and being able to do things on work premises. Rewarding and recognising the right behaviours. So this, after all, is how it's one of the blunt tools we have in an organisation to tell people about what we want. What we reward is often what we get. So being clear about that self-care is a positive wellbeing behaviour, and that's something that we want the organisation a behaviour that we want in the organisation, being aware of kind of how they come across to others. So being a manager who is approachable and who demonstrates those empathetic listening skills, because I have a bit of a phrase that I like to bandy about: you can't manage what you can't talk about. So if managers are not people who are approachable to talk about wellbeing issues, the issue is there whether you talk about it or not. So if you don't talk about it, good luck at tackling it. So we're trying to encourage managers to kind of be approachable and create a safe space for people to talk. And then the fourth is around having those all-important wellbeing conversations, which we very much encourage to be separate from formal processes. So, you know, they're not part of the performance conversation. They're something that should happen as part of normal business, and you know, repetitively, because exactly as you said, people's needs change. So you can't kind of put an action plan in place and then be like, okay, done, because circumstances change and people change. So to complement that, I've also brought out a toolkit for wellbeing conversations, which we encourage line managers to use, and that gives a kind of framework for that conversation to happen in a safe way and in an action-focused way. So we look at the priorities that individuals have around their well-being. So rather than kind of assuming what someone might need to do to take care of themselves, actually asking them. And again, that's recognising the changing nature, because people's priorities might change from week to week, depending on how their condition is impacting them. And talking about things that they can positively do to help themselves, and then things that the line manager can positively do to help them. Talking about ways in which they can thrive in the workplace, because actually it's really important to me that we talk about well-being not in a way of kind of when something goes wrong, what do we do about it, but actually how can we make sure that everyone can be their best selves at work, and that they can enjoy the experience of being at work and be part of the organisation. And also then the flip side of that, kind of what in the workplace might cause actually a negative impact for them, and what can both the line manager and the member of staff do to avoid that, and what can colleagues do as well. So what are the kind of warning signs that someone might not be feeling their best self? And everyone likes to be kind of helped in a different way. Some people like to have a fuss made of them, but others don't. So again, you know, not assuming that we should help people in a certain way, but actually asking them what helps them in that space. So it's very much around kind of empowering people, exactly as you said, to take care of themselves, and recognising that the organisation provides a container in which that can happen, you know, at one end of the spectrum very well and very positively, and at the other end of the spectrum it's actually impeding it. So really pleased to hear, you know, your research is backing up what we're already doing, which is great. So thank you for sharing that. I'd like now to invite you both to offer your recommendations for employers. So perhaps Judith, I'll start with you. What would you recommend that employers put in place for people with long-term conditions?
So make sure you know, when you're looking at your overall approach, that you have the systems that back up the policies and the conversations.
Great, thank you. And yeah, I mean, I really recognise that thing about how much energy it uses up, because sometimes I feel like I have two jobs. One is my job at the MOJ, and the other is everything that I have to do to make sure that I'm healthy enough to actually be able to turn up and do that job. So anything that can reduce that overall load is really welcome. Sally, what are your recommendations?
Yeah, so I think for me, I think there's one overarching recommendation, that is that I think this is an opportune time for organisations to value workers' health in its entirety. Actually, you know, long-term health conditions, whether you're affected by one or otherwise, you know, health is so fundamentally important. And, you know, sometimes I think it can be discussed as something that comes second to aspects of work and work demands. So for me, I think that is a clear recommendation to employers. Let's get our priorities right here, because actually success rests on the people sitting in our organisation, whatever that looks like. And, you know, that may sound cheesy, it may well do that, but I think what COVID has shown is how vulnerable we truly all are. So for me, this is about taking that seriously, rather than something that needs to be managed and fixed. Secondly, I think certainly a recommendation based on my research to employers is understanding and perhaps spending time with people affected by health problems and challenges, to understand the value of work to that population of people. I think there is still and remains this kind of societal message that, you know, a health condition, a health problem is linked with less capability, less drive, less resilience. I think we need to just smash some of that up. You know, that's such a long-standing message, and those days are gone. We kind of started talking about it with ageing workforces. And again, what COVID has shone a light on is that this is just not about getting older. This is about everybody with different risk profiles, I appreciate, but nonetheless, this is about everyone all in. And employers understanding that good work is really, really important to people. We want to be working, we want to be productive, we don't want to not be doing any of those things. So really what people are asking when health is challenged by their employers is, help me get back to doing the work I want to do. And that means, and thirdly, again, this is back to manager support, is manager support and the messaging of that manager support is really, really important. So this is about, for me, taking your workers seriously when they're unwell, not assuming that they are incapable, but working with them to give them the tools and the confidence to be able to start embedding back into work and doing the things that they feel capable of doing, rather than perhaps inadvertently putting obstacles in the way that actually slows things down. And what I mean by that is processes, policies, etc.
I absolutely love what you say there about smashing those stereotypes, because that's a message that I'm trying to put out actually within the MOJ, about just because someone has a wellbeing challenge doesn't mean that they're going to be the one in the team who's not the high performer. And it reminds me of something I heard a while ago, and I wish I could remember her name, but it was a disability advocate speaking in the House of Lords, and she had Crohn's disease, and she said something along the lines of that her condition had forced her to become adaptable, resourceful, determined, innovative and resilient. So what employer would not want someone working for them with those qualities? So I think it's a really interesting reframe. On recommendations, I think mine would be that employers need to be careful that they're not just talking the talk, they need to walk the walk as well. Because quite often I see the kind of tick box approach to wellbeing, where they have some yoga classes, and, you know, the thing when we were in the office was always fruit deliveries, wasn't it? You know, things like that, which is all around getting the individual to make healthier lifestyle choices. And more around actually, how is your leadership in that organisation? What is the culture like? Is there a culture of empowerment? Is there a culture of empathetic listening? Is well-being considered in decisions around how work is organised and who does what and by when and what is actually necessary to do in the first place? So I would say it's about threading well-being through everything that the organisation does, making it a how and not a what. So I would like to conclude then by asking you to give your one key takeaway from the discussion that we've had today, which I think has been really rich and thought-provoking for me. So let me start with you, Sally. What would be your one key takeaway from our discussion today?
I think my one key takeaway would definitely be that managing health when you're working has to be on par with work. And I think if it is, then we can get things done in the workplace in terms of supporting people in the way that they need to be.
Great. And Judith, what about your one key takeaway?
I think collaboration is key. So what we've talked a lot about through this is that collaboration between the line manager and the employee, and whichever other services they might need. But if you can get that right and there's that understanding between both, then I think you can have more successful outcomes for people with long-term health conditions in terms of remaining in and being happy at work.
And I think mine would be around actually one of the points that you, Sally, raised right at the beginning, which is there is no such thing as a one-size-fits-all experience for a particular condition or for someone who has a long-term condition. Everyone's experience is unique, so we should be approaching our kind of approach to wellbeing in the workplace through the lens of the person rather than the lens of the condition. So thank you both. I really enjoyed our conversation, and thank you all for watching.